In 1918, a strain of influenza known as Spanish flu caused a global pandemic, spreading rapidly and killing indiscriminately. Young, old, sick and otherwise healthy people all became infected, and at least 10% of patients died. Estimates vary on the exact number of deaths caused by the disease, but it is thought to have infected a third of the world's population and killed at least 50 million people, making it the deadliest pandemic in modern history. Although at the time it gained the nickname Spanish flu, it's unlikely that the virus originated in Spain. The 1918 influenza pandemic was the most severe pandemic in recent history. It was caused by an H1N1 virus with genes of avian origin. Although there is not universal consensus regarding where the virus originated, it spread worldwide during 1918–1919. In the United States, it was first identified in military personnel in spring 1918. It is estimated that about 500 million people, or one-third of the world's population, became infected with this virus. The number of deaths was estimated to be at least 50 million worldwide, with about 675,000 occurring in the United States. What caused the Spanish flu? The outbreak began in 1918, during the final months of World War I, and historians now believe that the conflict may have been partly responsible for spreading the virus. On the Western Front, soldiers living in cramped, dirty and damp conditions became ill. This was a direct result of weakened immune systems from malnourishment. Their illnesses, which were known as la grippe, were infectious, and spread among the ranks. Within around 3 days of becoming ill, many soldiers would start to feel better, but not all would make it. During the summer of 1918, as troops began to return home on leave, they brought with them the undetected virus that had made them ill. The virus spread across cities, towns and villages in the soldiers' home countries. Many of those infected, both soldiers and civilians, did not recover rapidly. The virus was hardest on young adults between the ages of 20 and 30 who had previously been healthy. Humphreys explains that in one count of 25,000 Chinese laborers in 1918, some 3,000 ended their Canadian journey in medical quarantine. At the time, because of racial stereotypes, their illness was blamed on Chinese laziness, and Canadian doctors did not take the workers' symptoms seriously. By the time the laborers arrived in northern France in early 1918, many were sick, and hundreds were soon dying. What were the symptoms of the flu? Initial symptoms of the illness included a sore head and tiredness, followed by a dry, hacking cough, a loss of appetite, stomach problems, and then, on the second day, excessive sweating. Next, the illness could affect the respiratory organs, and pneumonia could develop. Humphreys explains that pneumonia, or other respiratory complications brought about by the flu, were often the main causes of death. This explains why it is difficult to determine exact numbers killed by the flu, as the listed cause of death was often something other than the flu. By the summer of 1918, the virus was quickly spreading to other countries in mainland Europe. Vienna and Budapest, Hungary, were suffering, and parts of Germany and France were similarly affected. Many children in Berlin schools were reported ill and absent from school, and absences in armament factories reduced production. By June 25, 1918, the flu epidemic in Spain had reached Britain. In July, the epidemic was hitting the London textile trade hard, with one factory having 80 out of 400 workers go home sick in one evening alone, according to The Spanish Influenza Pandemic of 1918–1919, New Perspectives, Routledge, 2003. In London, reports on government workers absent due to the flu range from 25% to 50% of the workforce. The epidemic had rapidly become a pandemic, making its way around the world. In August 1918, 6 Canadian sailors died on the St. Lawrence River. In the same month, cases were reported among the Swedish Army, then in the country's civilian population and also among South Africa's laboring population. By September, the flu had reached the U.S. through Boston Harbor.